Bismillahirrahmanirrahim. It gives me pleasure to share my research finding on International Conference on Applied Zoology 2021. I'm grateful to the organizers for providing me this opportunity to discuss this online oral presentation. So the topic of my today's talk is pharmacological evidence to the usefulness of coumarin in metabolic syndrome. I declare no conflict of interest. If you look at the metabolic syndrome or non-communicable disorders, these are raising up and up. Like in developing countries, overall in the world, 35 million people are suffering from non-communicable disorders, including metabolic syndrome. And out of 35 million, 80% of the population belongs to developing countries like us. If you look at the data, the WHO shares that 1 billion adults worldwide are overweight and around 300 million are obese. IDF is also sharing that the 415 million people are globally had been living with diabetes in 2017 and would shoot up to 642 million by the year 2040. By WHO estimate, the prevalence of this disease, even in Pakistan, will be as high, has been recorded as high 9.8% in 2016 and is likely to increase in the future. So CMDs are the cardiometabolic disorders, usually depict a cluster of clinical features like insulin resistance, abdominal obesity, dyslipidemia, and hypertension. Dietary habits and the lifestyle patterns play a major role in it to aggravate and to promote and to boost the development of cardiometabolic disorders in the society. So keeping all these in consideration, the coumarins, which are the group of secondary metabolites, belongs to benzopyrone family, and these are found in many edible plants like coca beans, cassia, cinnamon, green tea, peppermint, and celery, so on and so forth. Its concentration is also varying from 1 mg to 87 mg per kg, and based on the substitution on its lactone and benzene ring, the broad category of the coumarin has been divided into four groups. So current study has been designed to optimize the safety and effectiveness of coumarin for metabolic syndrome using high sucrose in combination with fat-induced metabolic syndrome, a model developed in rats. Study protocol has been designed and approved by Institutional Ethical Committee, and then these pretty animals have been used for different tissues and in vivo experiments. Metabolic syndrome was developed in rats. In vitro assays were carried out using the isolated tissues from these rats, and then using tissue organ bath assemblies and histological studies were carried out along with serum biomarker analyses for to see the effect of this administration on metabolic syndrome. So the measurement of non-invasive blood pressure in rats were measured using cuff-tail plethysmography in conscious, anesthetized conscious rats, and this is the setup here. You can see the animal restrainer. Animals are usually restrained in this one, and the signals with the use of tail pulse pressure, the signals are transmitted into lab, and the data is represented in a graphical manner where this pulse stops, that the systolic blood pressure is thought to be start, and this reading represents systolic blood pressure. Initially, at the first step, oral glucose tolerance test was conducted. Here you can see a different time interval. And if you look at the different different groups in high-fat diet administered rats, the oral glucose tolerance shows much more glucose concentration compared to the metformin positive control and the treatment groups of coumarin, two doses 30 and 70 mg per kg. Similarly, their body weights were found to be possibly decreased in treatment groups at week 14th of the treatment with coumarin at the lowest concentration of 30 and 70 mg per kg. When the systolic blood pressure effect was categorized, here we can see at the week 14, it's a much more pronounced, which is similar to week 12, and the effect was found more pronounced in the treatment groups, and even in both treatment groups at the dose of 70 mg per kg higher dose and the lower dose, the difference was also found pronounced, showing a dose-dependent blood pressure lowering potential of coumarin in high sucrose and high fat-induced blood pressure rats. Here, if we could see, the diastolic effect was found pronounced, but it was much lesser compared to its effect observed on systolic blood pressure. Similar trend has been also seen on mean blood pressure. Then the mean blood pressure was also found to be decreased with different doses of the treatment. If we look at when at the terminal day of the study, when the animals were dissected, the serum was isolated and the serum was used to assess the effect of the administration on ADP, coumarin levels, leptin, and HMG CoA reductase. So we found pronounced effect on the treatment of both these treatments, 30 mg and 70 mg per kg of the coumarin, and in most of the cases, the effect has been found dose dependent, particularly in case of coumarin level, in case of adiponectin levels. However, a trend was found on the part of leptin and HMG CoA reductase. So again, highlighting its potential and possibly by influencing or having an attenuating effect on coumarin levels, on leptin reduction, and also in pronounced HMG CoA reductase activity is highlighting its role in metabolic syndrome. Then tissue reactivity experiments, so the vascular reactivity experiments were carried out using isolated tissue organ bath assembly, where these tissues were isolated from these animals and were mounted in these tissue organ baths, and the pressure transducer were there to assess any change in the elasticity of the tissues. Similarly, the aortic rings were mounted, and the acetylcholine was used to see the intactness of the endothelium. Here you can see the clear difference that here the endothelium was found intact, but however, in this case, endothelium was found denuded. So these observations were further checked on graphic presentations. Again, this one is showing the complete intact endothelium. This is showing partial intact endothelium, and this is showing around dysfunction of the endothelium. Here in a graphical representation, when this was checked for vascular relaxant activity, it pronouncedly relaxed the low potassium-induced contraction, and this was found to be inhibited when reproduced in the presence of non-specific inhibitor TEA or specific 4-aminopyridine. Isolated tissue organ bath assemblies, vascular integrity experiments also showed pronounced beneficial endothelial reviving retrieval effects on the part of the coumarin. And when the pancreatic tissues were assessed, it showed the restoration of the islets of the pancreas, where we can see in the treatment groups pronouncedly compared to this disease one. Their vessels were also being looked into, and we found the better architect in treatment groups. When immunohistochemistry was carried out for beta cells, mass assessment, the beta cell mass were found to be restored, which was in line in its in vitro finding in only H&E staining. And when the hepatic tissues were assessed, the normal architect was found in the treatment groups compared to the disease groups. So to sum these up, These data suggest that the coumarin possesses antihypertensive vasodilator properties mediated through activation of voltage sensor potassium channels, along with its effects on the adipokines. Therefore, this study provides a sound rationale for the pharmacological basis of coumarin in cardiometabolic syndrome, and this study could have been used as a lead on for future studies to develop it as a newer drug for the treatment of metabolic syndrome. This is just to acknowledge the whole group and some of our collaborators from the University of California, from King Saud University, and from Khan University, and also my own university, Government College University, Faisalabad. Thank you very much.